Cooler temperatures. Thanks so much. An emotional reunion takes us back to the future. Stars of the 80s blockbuster, Michael J. Fox and Christopher Lloyd, appeared on stage over the weekend at New York's Comic-Con. Fox revealed his mother recently died. The two of them have long worked to help find a cure to Parkinson's disease.
And we are joined now by Dr. Deborah Hall from Rush University to talk about Parkinson's. We're going to kind of check in on this condition, and she's here to answer a couple of our questions. Dr. Hall, thank you for being here. We appreciate it.
Yes, of course.
Okay, so some people were startled to see Fox's condition at this appearance itself. He talked about being optimistic, though, during the struggles that he has faced. Will you talk to us about how important positive mindset is for those who are living with this condition?
Right, so Michael J. Fox has really been a beacon of hope for patients with Parkinson's disease. And, we see him now and he's still on the stage and he's walking and engaged, and he has really also been helpful in bringing awareness to the disease and providing philanthropic efforts behind Parkinson's. So I think we're all very thankful, both the patients and the caregivers in the field of Parkinson's disease, that he's out there and really being a good ambassador for bringing awareness to the disease.
He was diagnosed with Parkinson's when he was 29 years old. He's 61 now. Talk to us about the changes you've seen in that time. I'm assuming there's been a lot of great innovation since he was diagnosed back in 1991.
Yeah, I mean, really the landscape of Parkinson's disease is dramatically different since he was diagnosed 30 years ago. And what has changed is that we've not only have a whole host of new medications to treat the disease, but we are delivering medicines in different ways. So we're able to use inhalers, we're able to use subcutaneous injections where patients can really give themselves the medication and it'll kick in very quickly in 15 minutes or 20 minutes. The other development is that we have several surgical interventions and really cutting edge interventions that can help tremor or other symptoms of the disease that really have developed over the last 20 years. And in fact, focus ultrasound, which is brand new for tremor for the disease, it was really only FDA approved a couple years ago. And this is an intervention that you go into an MRI scanner for a couple of hours, you receive this focused ultrasound therapy, and you walk out. It's an outpatient procedure, and you can have benefit for up to 10 years.
Wow. So
this sort of treatment for the disease is new and is exciting, and we actually can have this for patients here in Chicago.
Dr. Hall, let's look toward the future here. Where do you feel like the research is heading in terms of advances that you may expect to see in the coming years?
Right, so the future is very optimistic for this disease. There's a lot going on in research. And one of the big areas for research in Parkinson's disease is to try to stop or slow down progression of the disease. So the strategy in the disease is really to fix the protein problem that's happening in the brain. And in the brain, this protein is building up. If we are able to remove that extra protein, pull it off of the brain, it's likely we could stop or slow progression. So there's a whole host of research strategies that are being employed to try to pull this protein off the brain with immune therapies, with vaccine sorts of studies, and other really new cutting edge strategies like gene therapy to try to fix the disease.
That really sounds
so a lot
promising.
is going on. Yeah.
Thank you
disease.
so much. Yes, very optimistic, looking toward the future. Dr. Deborah Hall with Rush, thank you very much. We appreciate it.
Great. Thank you.